Here's what I'm about to tell you. 72% of men over 65 are making a critical mistake with their penis that leads to permanent dysfunction. And no, it has nothing to do with medication, supplements, or those ads you see online. I'm Dr. Claire Whitman, and I've spent over 20 years as a urologist here in Canada, working primarily with older men who've come to my clinic worried they've lost something they can never get back. And honestly, most of the time, they're wrong. What if I told you that the main cause of penile dysfunction in men over 60 has nothing to do with age itself, and that a simple daily routine, no pills required, could change everything? I know that sounds too good to be true, but stick with me. By the end of this video, you'll understand exactly what your body needs and why it matters more than you think. Most men don't realize their penis ages just like their heart, brain, or bones. They assume everything down there will just keep working like it did when they were 25, until one day it doesn't, and then they panic. I see it in my office every single week, men who come in embarrassed, frustrated, sometimes angry at their own bodies. But here's what I want you to understand right from the start. This isn't about being 25 again. This is about staying connected to who you are now, maintaining your dignity, your confidence, and yes, your intimate health well into your 70s, 80s, and beyond. Now I'm going to share 5 essential cares that every man over 60 needs to know about. And care number 5, that's the one 90% of my patients have never heard of, and it might be the most important one. But you need to understand the first 4 before we get there, so don't skip ahead. Let me start with something that might surprise you, maybe even make you a bit uncomfortable. But I'm a doctor, and if we can't talk honestly here, then where can we, right? Care number 1, maintain regular erections. I know, you're probably thinking, well, that's the whole problem, isn't it? But hear me out. Your penis is not just some passive body part that either works or doesn't. It's living tissue that needs oxygen, blood flow, and regular exercise just like any other muscle or organ in your body. There's an old saying in urology, use it or lose it. And unfortunately, it's not just a saying, it's basic physiology. Here's what happens. When you have an erection, blood rushes into the spongy tissue inside your penis, bringing oxygen and nutrients with it. This process keeps that tissue healthy and elastic. But if you go weeks or months without an erection, any erection, whether it's from sexual activity, self-stimulation, or even those morning wake-ups we call nocturnal erections, that tissue starts to change. Collagen builds up, the smooth muscle begins to atrophy, and the whole structure becomes less flexible. It's like if you put your arm in a cast for 6 months. When you take it off, the muscles have weakened, the joints have stiffened. Your penis works the same way. So here's my specific recommendation, and I want you to really listen to this. Aim for 2 to 3 erections per week, minimum. It doesn't matter how you achieve them, through intimacy with a partner, through self-stimulation, or naturally through morning erections. All of them count. If you're having trouble achieving erections naturally, there are tools like vacuum devices that can help maintain tissue health without medication. I'll put some resources in the description below. Now, I know some of you might be thinking about self-stimulation and feeling a bit awkward about it. Let me be clear. Masturbation is not just normal. It's actually a medical recommendation for maintaining penile health as you age. This isn't about pleasure, though that's certainly a benefit. This is about preservation. It's about keeping your body functioning. There's absolutely no shame in it. And honestly, the taboo around this topic has probably caused more harm to men's health than almost anything else I can think of. One quick note here. If you've had prostate surgery, this advice still applies, but it might look different for you. I'm actually planning a dedicated video about post-prostatectomy care because so many of you have asked about it. I saw that question in the comments with 57 likes, so I hear you. Make sure you're subscribed and hit the notification bell so you don't miss that one. All right, let's move on to care number 2, proper hygiene. And I'm not trying to insult anyone's intelligence here, but you'd be surprised how many men in my office have issues that could have been completely prevented with better hygiene practices. It's not that you're dirty, it's that nobody ever taught you how the body changes with age and how you need to adapt your care accordingly. Here's the thing. As you get older, your immune system isn't as robust as it used to be. That means bacteria, fungi, and other microorganisms that your body used to fight off easily can now cause infections, irritation, and inflammation. I've seen men come in with serious infections, balanitis, urinary tract infections, even more severe conditions, simply because they didn't know the proper way to clean themselves. So let me give you a specific 3-step hygiene routine. First, if you're uncircumcised, gently retract the foreskin. Don't force it, but do make sure you're accessing the whole area. Second, clean with warm water, and this is important, without heavily perfumed or harsh soaps. Those can actually irritate the sensitive skin and disrupt the natural pH balance. Plain water or a very mild unscented cleanser is best. Third, dry the area completely. Moisture trapped under the foreskin creates the perfect environment for bacteria and yeast to grow. Do this daily, every time you shower. It takes maybe 30 extra seconds, but it can prevent weeks or months of discomfort and potentially serious medical issues. And look, I know this feels basic, but I promise you, half the problems I see in my clinic could be avoided if men just followed these simple steps. Care number 3, regular physical exercise. Now, before you roll your eyes and think, yeah, I know I should exercise, let me explain why this is specifically crucial for penile health, not just general health. Your erections depend entirely on blood flow. When you're aroused, arteries in your penis dilate and allow blood to rush in. But here's the catch. Those arteries are tiny, some of the smallest in your entire body. And just like the larger arteries that supply your heart and brain, these small arteries can get clogged with plaque, narrowed by inflammation, or damaged by diabetes and high blood pressure. In fact, erectile dysfunction is often the first sign of cardiovascular disease because those small penile arteries show damage before the larger ones do. Exercise is one of the most powerful tools you have to maintain healthy blood vessels. It improves circulation, reduces inflammation, helps control blood sugar, and keeps your cardiovascular system running smoothly. All of that translates directly to better erectile function. My specific recommendation: aim for at least 30 minutes of moderate cardiovascular exercise 5 days a week. And no, you don't need to run marathons or join a gym. Walking at a brisk pace absolutely counts. Swimming, cycling, even working in the garden if you're moving consistently, it all works. The key is getting your heart rate up and keeping blood flowing through your entire body, including your penis. Here's a bonus tip that most men don't know about: pelvic floor exercises, also called Kegel exercises. You know how women are told to do Kegels after childbirth? Well, they're just as important for men, especially as you age. Your pelvic floor muscles support erectile function and ejaculation control. To do them, contract the muscle you'd use to stop urinating midstream. Hold for 3 seconds, relax for 3 seconds, and repeat 10 times. Do this 3 times a day. It sounds simple, but I've had patients tell me these exercises alone made a noticeable difference in their sexual function. Care number 4, maintain a healthy weight. I know, nobody wants to hear this one. But let me explain why it matters so much, especially for penile health. Excess body fat, particularly around your midsection, does several harmful things. First, it converts testosterone into estrogen. Yes, you read that right. Fat tissue actually produces an enzyme called aromatase that turns your male hormones into female hormones. Lower testosterone means lower libido, less energy, and more difficulty achieving and maintaining erections. Second, excess weight is strongly linked to diabetes, and diabetes damages the nerves and blood vessels in your penis. In fact, diabetic men are 3 times more likely to experience erectile dysfunction than non-diabetic men. Third, obesity is associated with chronic inflammation throughout your body, which damages those tiny arteries we talked about earlier. Now, I'm not saying you need to look like you did in your 20s. That's not realistic or even necessary. But if you're carrying significant extra weight, especially if your waist circumference is over 40 inches, that's about 102 centimeters for those of us using the metric system here in Canada, it's worth working on. You don't need a dramatic diet overhaul. Small, sustainable changes make the biggest difference. Cut back on processed foods, reduce your sugar intake, eat more vegetables and lean proteins, and combine that with the exercise we already talked about. Even losing 5 to 10 pounds can make a measurable difference in your sexual function. I had a patient, let's call him Robert, who came to see me at 72 years old, frustrated and feeling defeated. He'd gained about 60 pounds since retirement, and his erectile function had deteriorated significantly. We worked together on a simple plan: daily walks, cutting out his nightly bowl of ice cream, and adding more fish and vegetables to his diet. 6 months later, he'd lost 25 pounds and told me his intimate life with his wife had improved dramatically. No pills, no procedures, just lifestyle changes. Now, before I tell you about care number 5, which, remember, is the one most men don't know about, let me ask you something. If you're over 60 and watching this, drop your age in the comments below. I want to see how many of us are here taking charge of our health. And if you found any of these tips helpful so far, hit that like button so more men can see this video. Most people don't talk about this stuff, but everyone needs to hear it. All right, care number 5, avoid unnecessary medications. This is the one that surprises most of my patients because it seems counterintuitive, right? You'd think medication would help, not hurt. But here's the reality. Many common medications, especially ones that older men tend to be on, can significantly impact sexual function. Blood pressure medications, particularly beta blockers and thiazide diuretics, are notorious for causing erectile dysfunction. Antidepressants, especially SSRIs, can reduce libido and make it harder to achieve orgasm. Medications for acid reflux, antihistamines for allergies, even some prostate medications. All of these can interfere with sexual function in various ways. Now, let me be very clear. I am not telling you to stop taking your medications. If you're on blood pressure meds, you need them. If you're on antidepressants, they're important for your mental health. What I am saying is this: talk to your doctor. Have an honest conversation about your medications and how they might be affecting your sexual function. In many cases, there are alternatives that work just as well, but have fewer sexual side effects. For example, if you're on a beta blocker for blood pressure, your doctor might be able to switch you to an ACE inhibitor or a calcium channel blocker, which typically have less impact on erections. If you're on an SSRI for depression, medications like Wellbutrin often have fewer sexual side effects, but you'll never know unless you ask. And here's another thing. Some men are on medications they don't even need anymore. I've seen patients taking 5 or 6 different pills because doctors kept adding them over the years, but nobody ever stopped to evaluate whether all of them were still necessary. This is especially common here in Canada, where we have good access to health care. Sometimes we end up over-medicated because we're seeing multiple specialists who don't always communicate with each other. So my recommendation, sit down with your family doctor or a pharmacist and do a complete medication review. Bring all your bottles, prescription, over-the-counter supplements, everything. Ask about each one. Do I still need this? Are there alternatives with fewer side effects? What happens if I stop taking it? You might be surprised by what you learn. Now, let me address something I know some of you are wondering about. What about those pills you see advertised online or even the prescription medications like Viagra or Cialis? Are those bad? Should you avoid them? Here's my honest answer. Medications like sildenafil, Viagra, and tadalafil, Cialis can be incredibly helpful tools for men who need them. They work by increasing blood flow to the penis, and for many men, they're life-changing. I prescribe them regularly in my practice. But, and this is important, they work best when combined with the other 4 cares we've talked about. They're not a replacement for a healthy lifestyle, proper hygiene, and addressing underlying medical issues. They're a tool that can help, especially if you've got vascular problems or other medical conditions affecting erectile function. If you're interested in trying them, talk to your doctor. Make sure they're safe for you, especially if you're on heart medications. And please, for the love of everything, don't buy them from sketchy websites. Get a proper prescription from a real doctor who knows your medical history. Let me take a moment here to talk about something that came up a lot in the comments. What happens after prostate surgery? I saw one comment that got 57 likes asking about this, so clearly it's a major concern for many of you. And rightfully so, prostate surgery, whether it's for cancer or benign enlargement, can significantly impact sexual function. Here's the truth. Nerve-sparing surgical techniques have gotten much better over the years, but there's still often a recovery period where erectile function is impaired or absent. The good news is that with the right approach, penile rehabilitation programs, vacuum devices, Sometimes medications. Many men can recover significant function, but it takes time, usually 6 months to 2 years, and it requires commitment to the rehabilitation process. I'm planning a full video dedicated to this topic because it deserves more than just a brief mention. If that's something you need to hear about, make sure you're subscribed. Trust me, there are strategies that work, and you're not alone in dealing with this. Let me share a story that really drives home why all of this matters. I had a patient named Carlos who came to see me at 68. He'd had prostate surgery 2 years earlier and hadn't had an erection since. He was depressed, his marriage was strained, and he felt like he'd lost a fundamental part of his identity. He'd basically given up. We started a rehabilitation program, vacuum therapy, pelvic floor exercises, and eventually a low-dose medication. We also worked on his overall health. He started walking every morning, lost some weight, and addressed his diabetes management. It took almost a year, but gradually function started to return. Not perfect, not like when he was 30, but enough that he felt like himself again. Last time I saw him, he told me, "Dr. Whitman, you gave me back my confidence. I feel like a man again." That's what this is really about. It's not just about sex, though that's certainly important. It's about dignity, confidence, and what it means to age on your own terms. Your relationship with your body doesn't end with age. It evolves, yes. It changes, absolutely, but it doesn't have to disappear. I want to emphasize something important. Aging doesn't mean you stop being a sexual person. The narrative in our society is that older men and older people in general aren't sexual, don't have desires, don't have intimate lives. That's complete nonsense. I see men in their 70s, 80s, even 90s who are in loving, intimate relationships. It might look different than it did when you were younger, maybe less focused on penetration and more focused on touch, kissing, oral intimacy, emotional connection. But it's still meaningful, still important, still part of who you are. One of my favorite comments I read was from a 75-year-old man who said, "The penis is not the only sexual organ. We have fingers to caress, lips to kiss, tongues to taste, and sensitive skin all over our bodies." That's exactly right. Intimacy is so much bigger than just one part of your anatomy. Mental freedom, unrepressed desire, respect. These attitudes are necessary for a fulfilling, intimate life at any age. Let me talk about something else that often gets overlooked, the psychological aspect. So much of sexual function is mental. Stress, anxiety, depression, these can all impact your ability to achieve and maintain erections, sometimes even more than physical factors. And as we age, there are often psychological hurdles, worrying about performance, feeling embarrassed about changes in your body, anxiety about not satisfying your partner. Here's my advice. Let go of the pressure, seriously. If you're with a partner, communicate openly about what feels good, what doesn't, what you're worried about. Most partners are far more understanding and flexible than you think. They care about intimacy and connection, not just physical performance. And if you're experiencing significant anxiety or depression, talk to someone, a therapist, a counselor, your family doctor. There's no shame in getting help. I also want to touch on something that can be uncomfortable to discuss. If you've lost sensitivity, or if you feel like things aren't as pleasurable as they used to be, that's not uncommon. Sometimes it's due to changes in nerve function. Sometimes it's psychological. Sometimes it's related to medications. But there are strategies that can help. Changing techniques, using different types of stimulation, sometimes working with a sex therapist who specializes in older adults. Don't just accept it as inevitable. There are options. Now let me ask you this. Which of these 5 cares is the hardest for you? Drop a number in the comments, 1, 2, 3, 4, or 5. I'm genuinely curious to know what challenges you're facing because that helps me understand what videos to make next and what topics to dive deeper into. Before we wrap up, I want to give you a quick summary of everything we've covered because I know this was a lot of information. Care 1. Maintain regular erections 2 to 3 times per week minimum. This keeps the tissue healthy and functional. Care 2. Practice proper hygiene with a 3-step routine. Retract, clean with warm water and mild cleanser, dry completely. Do this daily. Care 3. Exercise regularly, at least 30 minutes, 5 days a week, focusing on cardiovascular activity. Add pelvic floor exercises for extra benefit. Care 4. Maintain a healthy weight to optimize hormone levels, reduce inflammation, and improve blood flow. Care 5. Review your medications with your doctor to eliminate unnecessary ones or switch to alternatives with fewer sexual side effects. These aren't complicated. They don't require expensive equipment or dramatic lifestyle overhauls. They're simple, practical steps that can make a real difference in your quality of life. And when you take care of yourself in these ways, it shows in how you walk, in how you relate to others, and how you feel about yourself. Thank you for being here, for listening, and for choosing to invest in yourself. Taking charge of your health at any age is powerful, but especially as we get older, it's one of the most important things you can do. You deserve to feel confident, capable, and connected to your body. Age might change things, but it doesn't have to take them away. If you found this video helpful, please give it a like and share it with someone who might benefit from hearing this. These are conversations that need to happen more often. And if there are specific topics you want me to cover in future videos, whether it's about prostate surgery recovery, specific medical conditions, or anything else related to men's health, let me know in the comments. Take care of yourselves, everyone. I'll see you in the next video.